Pranams to His Holiness. I warmly welcome everyone to today's session. Uh, I welcome all the faculties, students, healthcare professionals, alumni, and the viewers joining us on YouTube Live. As a part of World's Breastfeeding Week 2026, from 1st to 7th August, JSS Institute of Naturopathy and Yoga Sciences Coimbatore is conducting online health awareness program on maternal and child health. This year theme is breastfeeding for the sustainable start in life, strengthens what works. Breastfeeding gives the best nutrition and immunity to babies. But for the mother to breastfeed successfully, they need support from the healthcare, family, and the government schemes. So today we will be learning about government welfare scheme for mothers and infants, how they provide the healthcare, nutritional, and financial help and maternity benefits. Now let us into now we are happy to introduce our today's speaker. We are happy to welcome Dr. Shobika BNYS, Lecturer and Medical Officer, Department of Psychology, JSS Institute of Naturopathy and Yoga Sciences. Dr. Shobika is dedicated to maternal health, psychology, and community health education. Today, she will be speaking about government schemes for new mothers. She'll be explaining about maternal health care, nutrition support, financial assistance, and other beneficial available for pregnant and new mothers. I'm sure this session will be very useful for all of us. Now, I warmly invite Dr. Shobika to begin her talk. Over to you.
So, good morning, one and all present here. Let's start with today's session. So, today's session is all about schemes used during the pregnancy. What are the schemes in central government and state government? So, we'll be discussing each and everything in detail. So before going into the actual session, this is actually the continuation of the remaining 4 days. So totally 7 days it is a breastfeeding week. Okay. So why this scheme is very much important during pregnancy and what is actually going to happen because we have a large number of population, the people are getting affected with some or other condition, serious condition during pregnancy, and low weight babies and very undernutrition mother. So all these things are happening. So to control the mortality rate and the morbidity rate of both child and the mother, government has introduced so many schemes. With that, they are getting beneficial. So with this, we are going into the session. So first scheme is PICME, that is Pregnancy and Infant Cohort Monitoring Evaluation. So this is actually people who are residing in Tamil Nadu, they are eligible for this. So registration is recommended for every pregnancy. So whether they are deliveries planned in government hospital or in private hospital, they have to get registered under this PICME scheme, that is Pregnancy and Infant Cohort Scheme. So when to register, the important thing, there is no time limit for this registration, but early pregnancy during the first trimester, it is very much important to get registered to this program. So early registration, it helps in all the antenatal checkups and the benefits you'll be getting out of it. So how to register? You can approach your village health nurse, or you can go directly to the PHC and all those things, and there you can go for online registration. The PICME portal will be there. So in that portal, you can go and get registered using the following documents. The people should have the Aadhaar card of both mother and father, and mobile number, address proof, pregnancy confirmation details like scan report and first pregnancy, early pregnancy scan, those things should be there. And if you have any previous medical record, that also should be noted. And you have to have the bank account details. So with this, you have to approach the village health nurse, or you can go directly to the PHC or government hospital, or you can get registered using the online portal. So this is the first and foremost registration which you have to do once the pregnancy is getting confirmed. So second thing is the second scheme is Dr. Muthulakshmi Reddy Maternity Benefit Scheme. So in this scheme, what happens? They are completely used for nutrition support, and the throughout hospital care and antenatal care will be covered under this scheme. So pregnant women belong eligible category is Tamil Nadu, they should be, and generally it covers the first and the second delivery. So first primary and the second delivery, they can use this scheme. So mother should have completed the age. So 19 years of age is the eligible criteria. So once you get this PICME, the previous scheme we saw, right? So once you get that, you will have a RCH ID. So with that ID, and after getting registered, that is the basic scheme, you have to get registered. So after getting registered, you can apply for this Dr. Muthulakshmi Reddy maternity benefit scheme. And how you can apply, as I told earlier, you can go for the village health nurse, or any government health facilities which is there. And it is actually the PICME should be there to get applied for this thing. So what are the documents required for this thing is Aadhaar card, PAN, passbook should be there, and you should have RCH ID and pregnancy registration details. And what other details like salary certificate, it should be in a limited way. So all these things, what are our other documents they are asking, you should submit all those things. So what is the time limit for this? You can apply during the pregnancy after the registration of your RCHID. So complete required antenatal visit. So if you have to receive all the installment from the scheme, you have to complete all the antenatal visit properly. So what are the benefits you'll be getting out of it? You will get the financial assistance, like you will get some amount during the first and second trimester and at the time of delivery. And you will get a nutrition support kit. Two kits will be given. So first kit during the first and second month, and first and second trimester, and the second kit after that. So totally you'll get two kits, and it encourages your antenatal, whole antenatal care checkups and everything will be taken care of this scheme. And then third one is your Pradhan Mantri Matru Vandana Yojana, PMMVY. So this is another scheme which is given by central government. So central government maternity benefits, uh, it is going to give some amount of cash for your delivery purpose. So eligibility criteria, so the pregnant women or the lactating. So both these mothers, the pregnancy, during the pregnancy and the during lactation period, you will be getting some amount of some funding from central government once you fill the criteria, fulfill the criteria of what is mentioned in this scheme. So mainly it is actually taken for first living child, and second child benefit is if a second child is a girl, then you can apply for this PMMVY scheme again. Okay, so if if a woman is getting paid maternal leave or something, if any benefits they are getting, they are not eligible for this scheme. This also you should submit the salary certificate. It should be under certain limit. So then only you can approach for this scheme. So when you can apply after your pregnancy registration, that is after generating your RCH ID and everything, you can apply for this. So within your LMP, the last menstrual period, and between the pregnancy date, you can apply at any time, because you are going to receive the funding till your lactation period. So this is the criteria for the application. So you can approach any Anganwadi workers or ASHA workers. You also have this PMMBY portal. You can log into the portal using your RCH ID and everything. And from there, you can, if you are eligible, you will get the amount through the bank account. So what are the requirements? You have to keep your Aadhaar, bank details, mobile number, then your pregnancy registration details and childbirth registration details. So all these things you have to submit once you're applying for this. So time limit. So within the current LMP and the childbirth, that is the time limit. Within that, you have to apply. Then after that, you can get benefits out of it. So what are so direct the amount which is going to be given to you will be directly uh, put in your account, and it will be an installment based payment. So if you are getting 12,000, you are eligible for 12,000, you will get 6,000 as one payment, and the remaining 6,000 will be given after that. So next is Janani Sishu Suraksha Karyakram, that is JSSK. So this is actually initiating providing the free and cashless maternity services, the checkup, whatever they are doing from the first trimester till the third trimester. So all the expenses will be covered under this program. That is Janani Sishu Suraksha Karyakram. Okay, so who is actually apply eligible for this? Pregnant women who is going to deliver in the government health facilities, that is government hospitals. If they are going to deliver their babies, they will get the benefits out of all these things. So there is no separate application. You can directly like approach the hospitals and apply for this if you are going to deliver your baby from the government hospital, and all the antenatal checkup and everything from the government sector. If you are going to do, then this scheme is eligible for you. So you can register at any government hospital or even public health service centers, and all these things you can do. Okay, so documents, what are the documents required? Same Aadhaar you should have, and the pregnancy records, whatever the records you were having, that also you should have, and the hospital registration details should be there. So with all these things, you can apply for this scheme. So when you can apply, this is actually available during pregnancy, delivery, and the postpartum period. Okay, so you can apply early so that you will get benefits out of all these things. So what are the actual benefits of all these things? Free normal delivery, even if it is a cesarean section, it can also be done for free, and free medicines for throughout the 9 months, and free investigation, blood report, everything you will get free out of this scheme. The thing is, you have to deliver your baby from the government hospital. Then you can get benefit out of this scheme. Next is Janani Suraksha Yojana, JSY. So this is actually under National Health Mission promoting institutional deliveries. Okay, so this National Health Mission program, they have given this program, Janani Suraksha Yojana. Okay, so it is also providing you the financial assistance to the eligible candidate. So eligible pregnant women who is same delivering from the government approved hospitals, that is actually government hospitals. This is government aided or approved hospitals. So I same, the criteria will be depending, it changes from state to state. Okay, so this also covers the during pregnancy and before delivery charges and all the benefits. So you can go and contact your ASHA workers, VHN or health worker. From there, you submit the required documents like Aadhaar, bank passbook, and pregnancy registration details. After once you are getting eligible for this scheme, you will get registered and you will get all the benefits out of it. So apply you have to apply around your delivery period. So cash incentive will be given if it is a proper government aided institutional delivery. So next is Pradhan Mantri Surakshit Matrava Abhiyan, PMSMA. Okay, so this is actually providing free quality antenatal checkups. Okay, so by specialist normal doctors, if you are having any like emergency, or if you are having any difficulty during the throughout the pregnancy, the all the expenses will be covered once you are registered through this scheme. Okay, so generally all pregnant women are eligible for this. Again, it is very much important to have a proper salary certificate, and if it is a first pregnancy, the financial status, if they are getting any paid leave or something, all these are their criteria. So when you can apply for this during pregnancy, especially from the second trimester, after completion of first 3 months, once you go for the second trimester, you can apply for this PMSMA, that is Pradhan Mantri Surakshit Matruva Abhiyan. Okay, so you have to have your MCP card and pregnancy registration details should be there. With this, you have to submit the Aadhaar, bank passbook, and pregnancy registration details like RCHID. Everything should be submitted with all other required government documents. Once you get eligible for this scheme, you will be getting registered and you will get all the benefits out of uh, like for from the checkup. You will get if it is a complicated pregnancy also, you will be taken care with full concession and under the scheme. Okay, so here also you are getting cash incentive for the eligible institutional deliveries. So this is one scheme. Next is Suman. So in this scheme, they are assuring quality maternal and newborn healthcare services in public facility. Okay, so their eligibility, uh, obviously pregnant women and mothers after delivery, the care will be taken, and for the newborns also, the vaccine and mother during the pregnancy, generally they have to take some vaccine, so that also is covered in this. All these things are covered under Suman. Okay, so you don't have any separate application. You can go to the health service sector or the government hospital. You can apply with the help of the RCHID. Okay, so what are the documents required? All the pregnancy records, then the hospital registration details. So during you can apply during the pregnancy and even at the time of delivery, or even the postnatal period also you can apply and get benefits out of that. So with this scheme, you will get free antenatal care, free delivery services, free medicines and diagnosis with newborn care support. So these are the very important schemes which are actually covered during pregnancy. So the basic and foremost scheme in this is pregnancy and infant cohort monitoring and evaluation, that is PICME. And the second is your Dr. Muthulakshmi Reddy maternity benefit scheme. So these are the two major schemes. First one is the basic thing. Even if you are going for checkup or going for delivery in a private hospital, you have to apply for that to generate that RCHID. So with that only, that is the basic ID you should have, and with the help of that, you can apply for this Dr. Muthulakshmi Reddy maternity benefit scheme. This two scheme is actually solely and only for Tamil Nadu, people. So with all the reference and with all the proper documents, people can apply for this scheme. Okay, so these are the major schemes which are actually there for pregnant and lactating women. Even for newborn, they have scheme. So why it is very important to for know all these things? Because we don't, there are many services provided in and around by the government, especially for pregnant, lactating, and even for newborn, which many people don't know. So with this, they are reducing the mortality and morbidity, concentrating on proper health care and proper checkup, giving them proper nutrition. They will provide the nutrition kit also and all these things. So that nutrition kit will contain some um, like really beneficiary things, so which you the pregnant women can use. Okay, so with this, we have completed what are the schemes which are there in and around. So it covers the central government schemes and also state government scheme. So I think this session would have been like really a eye-opening session, because these scheme, if you are not pregnant or if you are not using also, people should know as a medical profession, as a normal public, which you can advise to other people. So I hope the session was very useful, and try to use this knowledge as a doctors also to your patients, and as a public you can get the information. You have all the portals. Once you like type the scheme name, you will get the portals. So inside that, the basic documents what are all needed will be also given. So with that you can get used to it. So thank you, and thank you for watching the session.
Thank you so much, Dr. Shobika, for your wonderful and informative session today. You explained the government scheme for new moms very clearly. You told us where we need to approach, what documents are required, the importance of visiting the PHC, and also about the mother and baby kit and financial assistance provided by the government. So, this information is very useful for all mothers, family, students, and healthcare professionals to ensure better maternal and child health. We sincerely thank you, Dr. Shobika, for your valuable time and for your guide as so well. Thank you. Dear viewers, this was the day 5 of World's Breastfeeding Week 2026. Tomorrow, we will be back with another useful and important topic for new mothers. Please stay connected and join us again. Thank you, everyone who joined us today. Have a great day. See you tomorrow.